Hey everyone, this is Dr. West with West Clinic Live, the YouTube stream. I'm really excited to share this with everybody. Hey everyone, it's Dr. West. I'm excited to share some ideas with everyone and what's happening into the office, especially around this pandemic and the questions that I'm getting asked all the time in the office. And it was about hydroxychloroquine, and people are thinking that they were going to have a death sentence if they didn't have it. And now what it is it's the testing. And I'm excited to go over what I've learned about the testing, some interesting things. If we just pull up here on the website here, and looking at this over here, got to get to the right thing. It's talking about the coronavirus and the testing. How reliable are the COVID-19 tests? I think those are really important to look at and consider. The current tests, it's hard to do. I mean, you have to do it the right technique. It's sticking a swab way back into the nasopharynx. Now, I want to be clear. I haven't done this test, and so it's only what I've read. And then really what everybody is trying to get a hold of right now is there a way to do at-home testing? This is what everybody's asking me about in the office. And I do have some really neat stories I need to share with you in the office too, because if you're like me, man, I'm tired of all of the stuff just focusing around the pandemic, and obviously it's affecting our life, but there's also some things that we can do that we really need to get some hope, some vitamin H going and look at the numbers and the statistics. But I really do want to go back to this coronavirus testing thing. So let's talk about the different tests, and we have to be careful because there's a lot of false negatives that are going on and giving people a false sense of security. The current 19 antibody tests aren't accurate enough for mass screening, said Oxford researchers, and that was about 12 or 1 o'clock. And then what happened is there was something that came out. Let's see here. I was just getting ready for the live cast, and it's not on the, here it is right here, this website. FDA approves Rutgers saliva test for COVID-19. Now, I think that this is really a game changer if it's accurate and if it's working, because what that means is we can give people a test, we can know if they have an antibody or a screen. Okay, so man, I have been having these great conversations with myself. So now that I've got the live screen dialed in here, FDA approves Rutgers saliva tests. Now, I really like saliva testing. We've used it for years to test estrogen, progesterone, testosterone, DHEA, cortisol. And if this test is accurate, wow, I'm really excited about this. Now, to date, it should be known that there isn't a good test to do at home to see if you're immune. But that's what everybody's going for. I want to keep everybody up to speed and up to date on that, because what that means is it can show if you've been exposed to the virus, and it can show if you have antibodies. Now, aside from this Rutgers test over here, the testing for the 19 antibodies, what we know on the Wall Street Journal, which I thought was really fascinating, is the testing and how it's working and stuff like that. And they haven't been able to differentiate from the benign coronavirus, which is the common cold virus, and what's happening with the most significant or disease-causing virus. So what does that mean? It means that, hold on just a second to get it kicked over.
You have a live feed on your screen. Can you see it, that title? There you go.
Okay, so I'm just getting a little help from my son. Appreciate that. So what does this mean to everybody? Okay, so just to give a recap, this is what everybody's asking about in the office. Number one, how worried are you? And the answer is the same as I was a week and 2 weeks ago, which is you got to take care of your immune system. If your immune system is healthy, then things are going to be good. If you get into the high-risk exposure, they're talking about the hydroxychloroquine. We did a presentation about that and why I don't think it's necessarily a death sentence, especially with the information that Dr. Levy and Dr. Chang are putting out, which is the high-dose vitamin C there. They're saying the hydroxychloroquine is taking 4 or 5 days to really help people. I don't know. I haven't prescribed that drug. I've only seen the backside of that drug, which means people coming in and struggling with some of the things that how it's making them feel. But I will tell you this, like I'm for what's working. And so anyway, I just need to get this caught up just a little bit. Okay. I got to ask my son a quick question. Okay, never mind. We're going back to the live screen right here. Okay, just really quick to do this. So anyway, everybody's asking about the home kits. I'm aware that the home kits can give you a false positive and false negative. And then as I was putting the presentation together, the FDA approved Rutgers for an emergency use authorization for Rutgers RU-CDR infinite biologics to test saliva. If this can prove that you have immunity or you've been exposed to it and you have the antibodies, what a neat test. I'm so excited to learn a little bit more about that. So that being said, I want to share with people some other things about the coronavirus. I had a patient called me from California that said that they were really sick, suspected they have the coronavirus, went over the protocol with the vitamin A, the zinc, the vitamin C, had a 24-hour response to good health. We've seen that happen with a local girl here named Haley. So there are some ideas that it can really help if it's the mild or asymptomatic of just getting your immune system in place. We're also talking about how important it is to hydrate yourself. And if you're just joining us on the live stream, what we've been talking about is there an applicable COVID-19 test where they don't have to do a nasopharyngeal swab inside the hospital system because of the shortage of tests. There's some companies that have said that they have an at-home test. However, there hasn't been anything approved until a couple hours ago, and Rutgers got approved for an emergency use saliva test. I sure hope that that pans out. The other thing that we're talking about is some neat things that we're seeing in the office. I just wanted to give everybody a shout out. Now, I got to tell you the story. Let me move myself here so I can get over to the right side of the screen. There I go. I want to introduce everybody to a feel-good story of the day, independent of the coronavirus. This is Emily and Rowan Nielsen. I haven't seen Rowan for a couple years. He had a severe skin rash that was not responsive to steroid therapy and wasn't responsive to some of the other creams that was given medically. And so we put him on a protocol. This is him a couple years ago. This is picture 2 of just really rough skin around his mouth coat. Wait a second. I'm sorry, everyone. I had to push it live. I messed up again. Daggone it. So I wanted everybody to introduce you to Rowan. Okay, so here he is. And this is what Rowan looked like. Really nasty rash, yeast infection here. This has nothing to do with the coronavirus if you're joining us. It's just a feel-good story. I just wanted to give some people something different than COVID-19. And I haven't seen Emily for a couple years. She came into the office for something different, and she said, "Hey, do you remember Rowan?" And here's his picture. This is another picture, a different look at him. This is a close-up, just really angry, red, irritated skin. And what's really exciting about it, this is what we did for Rowan. We gave him a yeast antidote and a wonderful medicine called mycosidin. This is something that you can naturally do to help yeast and infections. And what's really cool about this is here's Rowan today. I mean, this is the neatest feel-good story. Yeast is possible to treat without an antifungal and a lot of steroids. And you can see this beautiful little boy. It's about 5 years later. And my shout out to Emily and Rowan Nielsen for providing the patient story of the day. So a lot of good stuff out there. That's why we're working with people in the office and balancing out their immune system, because if you balance people out, sick people usually are not imbalanced. And that's really simple. You run out of energy and then you get a sickness or a problem. So with that being said, here is the overview. I hope that the Rutgers test is really good for saliva. I have really good outcomes. I like saliva testing. And then let me show you this other thing that I wanted to talk to people about. It's about eating. Now, the reason why I bring that up is because I don't know if anybody else is struggling with food take during the stay-at-home orders. And what's happening is we're looking at Fitbit data, and it's 60,000 or 60% of people are doing way less activities than they were before the shelter-at-home order. Yeah, probably no surprise on that. However, in order to keep yourself healthy, a couple rules: lots of water, good food, and healthy things to eat. And this is just something that my dad and I put together about the role of fruit in health. And so it's one of those nutritional axioms, you are what you eat. And I love this picture of the guy with the hamburger here. What do you look like if you ate your food? And then the question about if you are what you eat, are you fast, cheap, and easy? Now, it's kind of a funny little statement, but I want to bring some attention to fruit, because really where I think the benefit of the fruit is when you eat it. We're going to talk about that. We all think about fruit just meaning to cut up stuff, putting it in our mouths, but there's some rules that I think make fruit healthier. And let me just show you the timing. So let me get to the right slide. The correct way to eat fruit is not after a meal. Fruit should really be eaten on an empty stomach. And there's a couple reasons why I think that is applicable. And is this a fast and hard rule? It's not. But if you guys are just joining us on the live stream, we're talking about how to be as healthy as possible during the shelter-at-home place, doing the social distancing. We gave a real quick update on the coronavirus and the testing, that none of the antibody testing has been approved yet, which means if you've been exposed to the virus, are you immune, and can you go back to work and get in society? This is really where the direction is going, and with a game changing. And then just before this, like 2 hours before the presentation, they talked about Rutgers University being approved for emergency use assessment by the FDA for a saliva test. Man, I'm so excited, and pay attention to what's happening with the saliva. Now, getting back to what you can eat at home to be healthy, usually I tell people you need colors on your plate: some red, some green, some yellow. Skittles and Starburst don't count. It has to be plant-based material. And the other thing that's important is you shouldn't treat fruit like dessert, or it's going to treat your body just like dessert. Now, what does that mean? It means the fruit should be designed to be eaten on an empty stomach. And then what that means is it's easier for your body to digest and use after you put a bunch of protein and carbs and stuff proteins and fats in your system. It's harder for your body to utilize fruit, in my opinion. Now, again, this is just my observation of 20 years in practice, but I do think fruit is an enormous health benefit, and it's so important for protecting your immune system. You have to be careful, though, because if you eat fruit at the wrong time, it can clog your GI system. And let's say you eat 2 slices of bread and then put a fruit in, or cake, and people say, well, wait a minute, I don't eat cake. Well, if you take toast and you put butter on it and then you put jam, hey, guess what? You're eating cake. And then if you put some fruit on top of it, it really does act like a clog for your system. So fruit after meals really has a tendency to make some acidity, and the minute the fruit comes in contact with the food in the stomach, if you're eating it after meals, the entire mass, it starts to spoil. So if you're having indigestion, please try this. Like this is easy, it's inexpensive, it's not a medicine or a supplement. Just try and eat your fruit before you eat your meal. Don't use it as a dessert. And if you eat your fruit on an empty stomach, it's a lot better for you. Now, every time, I just had someone tell me this, every time I eat watermelon, I burp. And when I eat a meal, it burps. And when I eat a banana, it feels like running to the toilet. I really think it's a timing issue. And it's easy to test. Just put the fruit on an empty stomach and put your fruit after it. And then the other thing is you want to be careful with the fruit juice as it's making gas. And I tell people, like, you really shouldn't drink juice. Fruits are made to be eaten, and then it's a lot healthier if you will eat your fruit and not drink it. So this is just a couple ideas that I was trying to share with people of, hey, let's get some good news out there. We had a really neat testimonial story with Rowan, and Rowan had overcame this yeast problem. little boy was about 2 when we saw him. Haven't seen him for 4 or 5 years. Mom came in, and I'm really excited. I'm going to post it on our daily blog and up on our YouTube channel. And then also about the COVID-19, I think the direction that we're pushing is if we can prove that you've been exposed and have antibodies through a blood test or possibly this saliva test that was just approved by the FDA, it's really going to help our society to get back to normal. And just recognize this. It does seem that everybody's going to be exposed to this. There's a lot of people that are asymptomatic or having mild symptoms. Unfortunately, I think we're over the 20,000 death mark, which is really tragic. And the difference between people that are getting better and not having a lot of symptoms is most likely their immune system. Now, everybody's hearing a story about a nurse or an ER doc that's been exposed and literally overwhelmed with the virus. It's such a tragic story. My heart goes out to the families. For everybody else, we just got to knuckle down. Water, food, good foods, making sure you have vitamin A, vitamin C, zinc, and stuff like that in your system. And then the fruits. I'm challenging everybody, just try to eat your fruits on an empty stomach or eat them before you put in your protein and your complex carbs and your vegetables. It'll help with your system, is my observation. So that's really about as far as we wanted to go in the live cast. We're trying to get information out to give people health at the shelter home. We're helping people in the office. So Rowan was an example. We had a really neat case of a Lyme disease case that we're going to share with everybody tomorrow of how we were able to take someone that was out of hope and out of time and get them their health back. And so that's really the real quick review on Facebook Live. A real quick shout out. If you need a good source of vitamin C, we just got a shipment in. It's really hard to keep up with. It's 1,000 milligrams for kids. We have a chewable vitamin C. It's been hard to get it for the vendors because everybody's taken out. So if you need some vitamin C, please get in contact with us. If you have the vitamin C, make sure you're around 3,000 milligrams, 30 milligrams of zinc, 10,000 units of vitamin D, 10,000 units of vitamin A is kind of some recommendations. Oh, also, we did a post last week about how Dr. Rowan, who's one of my heroes out in California, he published a paper on a hypothesis of why the coronavirus cannot handle oxidation, and there was actually a run on how to do that. And one of the best ways I think you can do that is consider oxidative medicine. If you have access to a hyperbaric chamber, I can't see a downside to that. And there's also some home ozone units. I just got a couple more that are coming in on Wednesday. And so if you need an ozone unit, would you please reach out to me so I can help you to do that? That's really the story for the West Clinic and the West Clinic family. I'm Dr. Jason West. Can't wait to share with you some new and exciting stories of patients that are beating their disease. Remember, you're not your diagnosis. I'll see you guys on the next live cast.